Welcome to In Session Taking Back Control. This podcast contains discussions on topics related to mental health, which may include sensitive and potentially triggering information regarding violence, abuse, addictions, and other mental health conditions. The experiences shared by our guests are personal and represent their individual perspectives. They have voluntarily agreed to share their stories with the aim of fostering understanding and awareness. The content of this podcast is intended for informational and educational purposes only and should not be considered professional advice. It is not a substitute for seeking professional help, diagnosis, or treatment. Always consult a qualified mental health professional for any concerns or questions related to your health and well-being. Listener discretion is advised. If you find any content distressing, we encourage you to pause the episode and seek support from a trusted individual or a mental health professional. Thank you for listening to In Session Taking Back Control, and we hope that the conversations that we share contribute to a deeper understanding of mental health. Hi Katie, just want to take a chance to welcome you to In Session Taking Back Control. So thanks for coming on the session today and spending a bit of time with me and taking the opportunity to tell people who you are and what you do and share some of your experiences. So just for anybody who doesn't know who you are, can you tell me a wee bit about who you are and what you do?
Of course, thank you very much for having me. So I'm Katie. I am a CBT therapist working with young people aged kind of 12 and above, adults as well. And I kind of work throughout West Lothian working with a charity currently and work with Better You as well, doing some clients online. And I also have my own private practice called Brave Space CBT, which I see some clients do that as well.
Brilliant.
Yeah.
Good to hear. So you have lots of stuff going on there here at the moment, but what I like to do with a lot of guests is before we get into the here and now stuff and think about and talk about what you're currently doing and what you plan to do in the future and the great work that you're doing. Just want to take you back because usually what we assume is that who we are today is driven by who we were as children and the experiences we've had. So just tell me a wee bit about who you were. So to introduce me to wee Katie back in the day.
Wee Katie was hyper for sure.
Right.
Into 100 different things. I think I started horse riding, gymnastics, swimming, dancing, football, every hobby under the sun. I was on the go, which is very much the same as I am now, on the go constantly with 100 things on. Working best under stress, as I still do. I would say there was parts of my childhood and my childhood self that surprisingly was probably quite introverted. I think in some settings I didn't always kind of feel like I would fit in certain places. So I think there was a part of me, although I was always this really kind of bubbly, outgoing, chatty child, there was a side of me that was also very introverted and kind of kept myself to myself a lot in situations. But I would say I'm probably quite similar to that now. Although that's probably the side that people don't see. People say my kind of more bubbly, chaotic side, the 100 miles an hour side. Yeah, as a child, I would say I was always the kind of very similar to I am now, the joker in the room, and the one always trying to make a laugh out of everything and trying to make jokes with everybody. So I would say there's still probably a lot of my child self in me now, and I probably carry her around with me more often than I think I do, in more situations than I would even like to probably. But she's definitely still there.
Right. So introverted and extrovert. So is that something that you're saying that's kind of led through right to now? But is there a reason? Where are you most comfortable in the introvert or extrovert type of person?
In particular settings, work settings or group settings, I'm more comfortable in my extroverted side. It's kind of funny, I get a lot of people say to me quite a lot that, oh, you seem like you've got a lot of confidence. But actually, inside, I do not. But I can kind of get it to come across that way. My introverted side, I would probably say, would be around just very particular people in my life. My mum and dad, my best friend, definitely. A couple of other people that are close to me, but not, I wouldn't even say my whole family. There's only a select few that probably see that introverted, kind of quiet, insecure side to me probably, and then my comfortable place of being is my extrovert side.
Because so it sounds like the people that you trust get to see probably would you say it's the truest version of you? You know that you know how the Japanese have that, um, they talk about that three masks that people wear. You know the three masks that the first mask is for people outside of your close circle, like work and all these types of things and society. Then you take off the other mask after that is for like family and friends, and then underneath is really the truest version of yourself. So that kind of the vulnerable part when all the masks are off.
Absolutely. I would say I don't even know. I think probably for most of us, our real true self is probably only seen by ourselves. I don't even know if we show our real true self to every single person, but definitely that side of myself is to the people who are closest to me, which is even at that a very select few.
So did that play out? And you're saying that played out kind of through your early years, and would you say it carried out through school as well?
Yeah, definitely. I've grown up with two older brothers who are quite far apart in age from me. So I've got a brother 14 years older than me and another brother 17 years older than me. So although I've got siblings, I've grown up very much as an only child. And I think that part has had a big influence on me, probably sticking a lot in my own company as a child. I remember playing schools and babies as a child, always on my own. And my mum and dad, I always remember them like laughing, like, who are you talking to up there? And it was just me playing with like pretend friends. But I remember a lot of my childhood being on my own. And I would say now I probably seek quite a lot of time on my own because that's a comfortable place for me. I like alone time. But I think as a child I've grown up that way, and I think that side's probably my introverted side.
Right. And so what was school like for you? You know, obviously like primary school you're talking about there, high school. What was high school like for Katie as she progressed kind of from earlier years and primary years?
I would say my primary school years were far more positive than my high school years. I think coming from such a small area and such a kind of small primary school, everybody in school knew each other. We all knew each other's families. We all grew up in the same area. It was a very kind of tight knit place, which there was comfort in that. And I think in primary school I got on really well with my teachers. Again, my nickname in school was Calamity Kate because I was forever doing something, dropping something, mess everywhere, which is the exact same as I am now. That has not changed. And then moving into high school years, I would say I struggled quite a lot in high school. My relationships with teachers were very different to what they were in primary school. I had very strong, positive relationships with teachers in primary school, and then I feel maybe that high school had a negative impact on my view of relationships with other educators, I suppose. I had teachers make some comments that have probably stuck with me quite a lot, which is why I've probably now led into more of the overachiever side of me and trying to, overachieve and be perfect in things. And I would say high school probably influenced quite a lot of that for me, which was quite difficult because I enjoyed school and I enjoyed learning and I enjoyed, what comes with school and friends and things like that. And I had great friends in school and I had a good group of friends. But it was the side of the teachers of some of the relationships that I had that I felt probably fed a lot into my self doubt, which then played a lot out in my adulthood.
Because I know, I mean, I know we both have experience working with children and young people, and we hear that a lot from young people in high schools, and the impact that just one person or one person that's supposed to be in a caring role that can say something that can truly impact sometimes the rest of their lives and how they roll that out. I mean, I know for me, and I'll ask you about your experience, but I know for me, someone once told me that I would never amount to anything. And so this was a teacher who taught sociology and didn't have a sociology qualification. They were an English teacher. So whenever he told me I couldn't amount to anything, I thought, screw you. So I went and got a sociology degree, not because I wanted to do sociology, just because I wanted to go back and rub it in his face.
Yeah.
So, and say I'm more qualified than you, which did happen. And I got the degree and all that kind of stuff, but it didn't really have the impact that I wanted or thought it might have, because I kind of had grown up then as well from that, instinctive, impulsive thought process of a 16, 17-year-old. So, but it still sits with me, you kind of have that part of, am I going to amount to anything? Have I amounted to anything? Was he right? Was he wrong? Who am I proving myself to?
Yeah.
What were some of your experiences that you heard?
Quite similar, Declan. Not so much I know you've said you've experienced there the comments around you not amounting to anything, which can be so damaging, as we know. Mine's was kind of more a lot of doubt because I was very much a jokey, out there kind of personality. I felt like at times I was judged for that, and I didn't actually have any kind of brains behind me because I was so jokey and laughy and kind of taking the piss, really.
Mhm.
I think a lot of that for me was masking. That was how I fit in, is by being this big personality. That's where I find comfort in being. So for me, that was me finding my feet in school, really. But I think that for a lot of teachers probably came across like, yeah, I was taking the piss and didn't really care, but I did. And there was I worked really hard in my last years of school to get my grades to go to uni. And, I really knuckled down and got my head down. But I think there was a lot of misunderstanding from teachers as to really my potential and what that could be. And don't get me wrong, I had some great relationships with some of my high school teachers. There's just two that I know on the top of my head, two female teachers that I had who were fantastic, and we had great relationships with them. We would always be in theirs at break time and chatting to them, and we had such a laugh and good banter, but that was because we respected each other. But I think it's difficult. I don't blame the teachers for it, but it's really difficult because when you've got a class of 30 children and you're trying to teach and there's loads going on, and each child or young person can have something different going on for them in their own life. It's not just about school, as we know. So I think being a teacher in those moments is probably really, really difficult. But equally, the words that can be exchanged in school can have such a big impact, as we know, and such a big impact then into your adulthood. There's one comment that stuck with me even to this day, and it's something that I have went back and kind of talked about myself in therapy, and it's stuck with me. And even now, in certain moments when I'm feeling like I'm losing confidence, that pops up
Yeah.
for me. And it's trying to kind of let that go a little bit, because we also don't know where that person was in their life at that time and what was maybe going on for them and why they've said that. So, it's maybe been an off the cuff comment that they've made, not realising the impact it was going to have. But your words
Yeah.
do have impact and they do stick with us.
Yeah.
And I think your teenage years are such a prime time for development and development of your own identity of who you are. So then when we receive messages and comments like that, it can be really damaging and have such a negative impact on the way that we view ourselves, which can then lead on to how we view ourselves in other situations, and how we manage that.
Right. No, absolutely. And it's, we hear a lot about what you're talking about there now is about being trauma informed type of stuff. We hear a lot of that now. And I heard the term today about, being overly trauma informed. Someone said to me, I'm getting inundated with trauma informedness. I'm getting, it's been just rattled so much. And I think that there is a level of, we need to understand what trauma informed is and the impact and how we sound things and hear things and what people hear, even if we're not, if it was a fleeting comment like you're saying, it can and will stick because that's something that it feeds into that probably that internal processing of what you already think about yourself. We're truly horrible to ourselves sometimes about the things that we say to ourselves, and no one will probably say anything worse to us than we've probably thought about ourselves. But when it's reinforced by someone and that kind of comes as actually I thought that about myself, I wasn't too sure. Now this person who is an adult, they're an educator, they know more, and they're reinforcing this must be true.
Hmm.
And then it sends you on that kind of trajectory of low self-worth, low
Absolutely.
self-esteem.
Yeah, because we look to our teachers as, when you really think about it, as children in primary school or young people in high school, we probably spend more of our day with the teachers at school than we do family members, whether that's people at home or extended family. Teachers have such an impact on young people's lives because they have so much time with them. And I think just thinking about that, then it's kind of thinking of how teachers can influence certain things with young people and the words that are being used and what's being said. And like I said, there'll be things that will be said that are fleeting comments, but they do stick. Words words definitely do stick, and they stick with us even into our adulthood as well. I definitely know that for sure.
Absolutely. Do you know, and it's funny you go back to that whole sticks and stones kind of thing that you used to say as a kid, but it's untrue, sadly. You know, words really do hurt. So I think it's that. And I suppose that's, I don't know what took you down the path of becoming a therapist. You know, I know obviously we're both therapists sitting here. I've known you for 5, 7 years. How many years?
2018 to now, what's that?
So 6 years.
6 years.
6 years. Well done, Katie. How many therapists does it take to work out a six?
We're
So,
therapists, not mathematicians.
well, true. True. But it is that part about, and I know I deliver training and train therapists as well. And there is a part where you kind of think, and I'll say to all therapists, jokingly but seriously, nobody in their right mind sits in the room with somebody all day, every day to listen to their problems. Do you know that there has to be something that brought you there? There has to be a journey or a path that brought you to become a therapist or want to be a helper. Because it's a tough gig.
Definitely. Something that I wouldn't change for the world. I feel so privileged to be in the work that I do, and I absolutely love my job as a therapist. And don't get me wrong, there's some really difficult moments, there's some things that sit very heavily on your heart. But knowing that you are extending a space to someone in which they can come and feel safe and feel they can talk about things that they may have never talked about, it is such a privilege, and something that I'm very thankful and grateful for, that I'm able to be on the other side of that story. Leading me into being a therapist. So when I left high school, I went on to study psychology for 4 years. And then when I graduated with my honours degree, I went into starting to work within kind of different mental health settings, both with adults, with children and families, sitting alongside social work, and working with young people and families where child protection concerns had been identified. And it was kind of from there I started to feel a little bit that I wasn't quite doing enough of what I feel I could be doing. There was part of me that felt I want to be able to do more to help people. I want to be able to equip myself with more skills to be able to explore things with people. And for me, that was really thinking about how I'm going to do that, and moving then into counselling. And it's really funny because before I became a therapist, I didn't think there was anything really driving my want to be a therapist from my teenage years and childhood and things like that. I just always felt like I wanted to help people and wanted to be in a position where I could use my knowledge and skills to even at least help one person. And that always came from just a place of being really caring towards other people and wanting to give other people the opportunity to be heard in times where they're not always heard in their own life. And then when I went to therapy myself and exploring my teenage years and exploring my childhood, I started to then understand that I hadn't quite identified the real reason as to what was driving me into these like helping and support roles. But
Yeah.
actually, I found it in therapy, and it was since then that it's kind of sat with me more. And probably my reason for going into working with children and young people in a therapeutic space, and that was beginning to understand actually how lonely I felt at times in my teenage years, and how I didn't always feel like I had a space to go and talk and a space to be. And I think feeling very misunderstood in my teenage years, which I know I've talked about, from teachers, but I think that also came from other people in school. And I always feel like I didn't present myself in a way that I actually am. I think I would present myself in a way that was probably not quite me, because I was just trying to mask how I was feeling, and then people would have a kind of perception on that, and then I would feel that would be the wrong perception of me. But it's because of how I've portrayed myself to cope with my anxiety and everything that I was feeling at that time. So going through therapy really made me realise that the reason that I'm in this role, more so than anything, is probably because I want to offer a space to someone, because I don't feel like I had that opportunity myself. So I think being able to, with any person I work with, but particularly the young people that I work with, giving them a space where if they don't have that place in school, if they don't have that place at home, then they have a place somewhere that they can come and talk and be themselves and not feel they have to hide any part of themselves in front of me. So that's probably what's got me into this, but it just took me a little while to figure that out.
Aye. And I think it does, and you have to go through that journey as well to work out why you want to do that work. And sometimes that resolution comes in your own therapy.
Hmm.
Part of that work is that we as therapists encourage each other to go to therapy so that we can process our own stuff, because I think there's also often a misconception that a lot of therapists have their shit together. You'll hear people say, "Oh, you're a therapist, oh, you must really have your shit together." What are your thoughts on that? Because I have my own, but what's
Yeah.
your thoughts?
Absolutely not. And I get those comments myself quite a lot. When I talk about my own anxiety, I've had people go, "But you're a therapist. How have you got anxiety?" And I think that's part of the reason why we're in the job is because we can understand we've experienced challenges with our mental health ourselves. And so then it's not everybody's experience is different. And the way that we all experience anxiety, depression, whatever it may be, is different for every single one of us. But I think when we've been in a position where we've had our own experience with those feelings, it allows you to be able to understand and sit with other people because there's a kind of shared kind of theme then that we've both had struggles and that's okay. And I think for people to know that, yes, we as therapists do struggle with our mental health and it's okay for us to struggle with our mental health. It's all right for us to have bad days as well. And it's normal, we're human at the end of the day, and when you're in therapy with another person, at the end of the day, we're two humans coming together, connecting in a room, and that's what
Yeah.
it's about. I know myself, I continually face my own struggles with anxiety. It's definitely got a lot better from learning myself, both going to therapy and doing the course. Sitting with other people and then hearing their stories has really helped me kind of manage my own emotions as well. But we're all on a learning journey. We don't have a rule book on how we manage feelings. So every therapist, every person, every human experiences difficult times, and that's part of our journey in life as well.
Aye. I totally agree because there's this misconception that either people who aren't therapists will think that you've got everything together and you're sorted and that you don't have an issue in your life, and or people think if I train to become a therapist, I won't have any more crap to deal with because I'll know it all. And it's
Hmm.
it's totally contrary to that. I think you make a good point. You're just a human being who experiences all the same stuff and all the same difficult life events and grief and loss and financial stress and relationships and all these different things that come, and that sometimes there can be that perfect storm. And it's known as well as a therapist that when you're okay to work with clients, but also when you're not okay to work with
Hmm.
clients as well. And that's an important reflection to take as a therapist when you're doing that work.
Absolutely. And kind of knowing your own limits in that. There's things that I can sit with in the room, which is absolutely okay. I'm able to sit with, but I know there's things that would potentially be really difficult for me, and that's all right. That's about kind of knowing your limits, and I think ethically, we're bound by ethical practices, and I think ethically as a therapist, that's a really good practice to take, is knowing your own limits and that, and knowing what kind of experiences you can work with, and then what you can't as well.
Yeah, absolutely. And you mentioned your own journey there, with anxiety and the experiences that you had, and you said that you sometimes still have that, and you work through that. So, but you're a CBT therapist. So I know one of the approaches for anxiety and one of the methods is CBT. So can you tell me a wee bit about what CBT is and how it would help anxiety, do you think?
Yeah, so CBT is a talking therapy that focuses at times more on the present and the here and now, but at times, if the person wants to, we can explore past experiences and what that's been like in childhood and teenage years. But for most people, it's working in the here and now to understand how our thoughts, feelings, and behaviours are all interconnected. They all have an effect on each other. So, what we're thinking affects what emotions come up for us, what physical feelings come about in our body, and that ultimately then affects how we behave in a situation because it's going to determine whether we go in and face things or we maybe avoid and then decide not to go near things. And CBT is about helping someone understand how that's all connected together. Particularly with anxiety, it's looking at, what's your triggers with that anxiety? what does it feel like for you? Because everybody, the way I experience anxiety is going to be different, you know, as we know, Declan, the way that you would experience it as well. So I think for people, it's understanding what anxiety is, where it's potentially coming from, what's its
Mm-hmm.
triggers. And I think for a lot of clients I work with, and myself included in that, is understanding what anxiety responses actually are in your body. When we talk about that fight or flight, you know, that's a real
Mm-hmm.
primitive response that we all have and we do need it. But at times it can kind of be triggered in situations that we don't always need it. And it's about understanding at times when that pops up and we can recognise it and say, oh, I don't actually need you right now. How am I going to calm you down and how are we going to do that? And it's about figuring out different kind of coping strategies that a person can use in order to calm that anxiety down. Along with it comes with a lot of behavioural experiments, which we talk about in CBT, which
Mm-hmm.
is kind of exposing yourself to situations or things that create anxiety in order for our anxiety to kind of hit its peak but drop and allow it to kind of settle out. And the more that we do that, the more the anxiety is going to settle and eventually get to a point that it's not necessarily about getting rid of the anxiety, because that's also not possible all the time, because we need
Yeah.
anxiety in situations, but it's about getting it to a place in which you feel you can manage and feel comfortable with.
Mm.
So, in a nutshell, that's kind of what we look at, but it's very different for every person, you know, it's very different. Some people will come in and want just coping strategies and we'll just work on that. And then other people want to really figure out what's driving it and where it's coming from. And I know that was for me when I went to therapy for anxiety, that was exactly what I wanted to do, was take it right back to childhood and let me see what the lead up to this has been. And for that was really helpful. But it just really depends what people want out of the time that they have.
Aye. That's a really helpful description of what CBT is, because I think most people will know from CBT is that it's the prescribed method within, local health bodies, NHSs, that type of thing, that you'll be prescribed. If you do get prescribed therapy, and if you're fortunate enough to get prescribed therapy and through the NHS, then it most likely will be the CBT approach, because the understanding anyway is that, it's that succession model where you kind of work to successions, and the hope is that there's an outcome to the presenting issue that you've presented with. But does that always work, do you think?
Personally, I think again it depends what the person's looking for. But if someone's just looking for, you know, very in the moment understanding of anxiety and coping strategies, then yes, 6 sessions might work really well for that person. But I think for most of us, I would probably recommend at least 12, because part of therapy that we don't always really talk about, it's not just about turning up and listening to a therapist talk and you get all these skills on a notepad and you go away and do it. It's about
Yeah.
building a relationship with your therapist. You know, you have to get to know your therapist as much as they need to get to know you, and the relationship really has such an impact on the outcome of therapy. As we know, it's kind of shown in research that it's one of the biggest indicators of success, if we want to say, in therapy. And I think sometimes 6 sessions maybe isn't always enough to establish a really strong relationship. So I think the 12 gives it that little bit longer for that person to start feeling that they can trust their therapist, because at the end of the day, they're coming into a room or coming online, however they're getting their therapy, to a stranger. You know, it's to someone that they don't know. So to have to come on and tell your whole story and explain parts of your life that you've maybe never opened up about before in
Yeah.
just 6 sessions is quite a lot to ask. So I think the 12 allows that time for that person to kind of get a bit of a feel of who their therapist is, and then hopefully get to a place where they feel they can be honest and share what they want to share in order to support them moving forward.
Aye. I think that makes sense, when you're talking about the 12 sessions. And I think my experience on average is depend like you say, depending on what the issue is for the person, because every person is unique. But when you're thinking, I mean, my own personal experience is on average between 10 and 12, and
Hmm.
that's not just me specifically using CBT. I'm an integrative practitioner, so I use a variety of modalities, but it's still on average kind of around 10 to 12. But you'll know yourself, sometimes that you're working with a client, and it is about relationships, it is about trust. And it would take me probably a couple of sessions to come in and fully trust a new therapist, to give them
Mhm.
my innermost secrets, because that's what you're asking for. You're expecting this stranger to come in and just spew out everything in the hope that you can kind of help navigate it for them to pull it together and find some sort of structure and way of coping. But that's not
Mhm.
always the case, because it depends who they are and where they are in their life stage as well. Because
Mhm.
you're a specialist young person and families therapist, so I imagine when you're working with children or young people, it's maybe a different approach again, is it?
Yeah, I would say so. And I think for the young people, the kind of age range that I work with young people is 12 and up. And, as children, we're programmed by the adults in our life to don't speak to strangers, don't talk to strangers. And then suddenly you're asking them to come into a room and talk to a stranger and tell all to a stranger, So I think, particularly for young people, where they're at a place themselves of big changes, not only developmentally, but changes in their life. If they're transitioning into high school or potentially thinking about what's going to come after high school, if they're in that kind of end phase of high school. And I think asking them to come into a room and talk to someone about how they're feeling is a really big ask. So I think for them, they need those extra sessions in order to feel comfortable and feel they can trust you. Ultimately, we need the trust in order for someone to feel they can tell everything they want to tell. And we know in therapy, the more honest you feel you can be, the better it's going to be, because then we can have a better look at things and explore things on a deeper level. But I think for young people, like I said, we've kind of programmed them to not talk to strangers, and then suddenly put them in a room with somebody and go, right, go and tell them everything.
Yeah,
So I think
yeah.
it does take that little bit longer as well. And I think for a lot of the young people I work with, they've had potentially different experiences from different professionals already. Not just therapists, but they may have had support from other organisations or
Yeah.
potentially social work and things like that. And it's if they've had difficult relationships with other adults already, and then you're asking them to then go and develop a new relationship with a new adult, there's
Hmm.
that part of it as well. So I always like to take extra care and extra time in my sessions with young people, particularly to just allow them to get to know me, and I freely ask any question they want to ask. If I don't have the answer, then I'll figure it out. But I think just allowing for those first few sessions to really be kind of more getting to know each other sessions before we deep dive, unless the young person feels comfortable. I do have young people come in and go, here's exactly what I want to talk about, and here's what's happening, which is absolutely fine as well. It just depends on what that person's feeling. But I think the approach for young people can feel differently in my approach to the work that I do with adults. Like I've kind of touched on, they're at a real developmental change in their life. And I think with adults, which is really interesting when I reflect on it, with adults, most adults come in and want to talk about things that have happened in childhood and teenage years.
Yeah.
But actually, when you're working with the young people themselves, they're in that moment, they're in that time frame, and that time frame is potentially going to have a big impact on their adulthood and the rest of their life. So I always feel so privileged to sit with young people at such a real important time in their life when all of these changes are happening. And if I can have even just a small effect on the way that they view things, or the way that they can manage their own emotions, or the way that they can be kinder to themselves, I can take that away and feel like I've done somewhat of a good job. So I think I always feel really privileged to work with young people at that stage in their life, because it's such a big.
And it is, and you used the word privilege there. It is a real privilege to work with children and young people at that age and stage. And I think people, and therapists included, can sometimes get a wee bit jarred with that and fear working with young people because of stuff like safeguarding issues, and what if they're taking drugs, and what if they're doing this and that and the next thing, and having sex, and and you're kind of like, well, what if they are? We deal with it
Mhm.
in the room and talk about it like you would to an adult. And I think that's the difficulty, that sometimes, because children and young people are talked for, so their
Mhm.
parent or their guardian or their caregiver they'll take them to the doctors and they'll talk for them. They'll take them to the dentist, they'll talk for them. They'll phone up like their sports centre is football on for them, all this kind of stuff. And I find sometimes for the very first time in their lives, sometimes whenever they come into the room with me, it's the first opportunity to get to actually first use their voice, and also to be
Mhm.
heard as an equal. rather than, oh, you're
100%.
such and such's child or such and such, and you're waiting on the parent to talk.
Hmm.
And parents struggle with that as well, but it can become quite liberating for the child once, and the young person once they understand that this information isn't going anywhere.
Yeah, absolutely. And one comment that I always make to every young person I work with is, I'm not your parent and I'm not your teacher, and I am not here to give you a row. That's not my
Yeah,
job. We're here to explore and, support anything that we feel we can that's going on for you right now. But I'm not there to get anybody in trouble. That's not my job. It's a space for, okay, if you
yeah,
are smoking or using drugs or alcohol, let's think about why, what's going on for you that you feel that
yeah,
you need to use that, and can we think about that, and can we explore that together? But I'm not going to sit on the other side of the chair and go, don't do that, stop doing that, because that's not my job. And my job is to sit and understand and help them understand themselves better.
yeah,
And I think it can be really difficult for parents, totally understandably, to let their child or young person go into a room with a stranger and knowing that they're not going to get any information out of it. And that's something that I always have to make really clear to any parent that I'm working with is, I understand that you want the best for your child. Equally, this is their space and I have to give them their privacy within that. I will only share with you when I have concerns, if I have concerns. But other than that, I will not give you any update from sessions, because that young person, like you said, this might be the only time in their life where they've had a space that's just for them. And it's
yeah,
not going to go back to anybody else, whether that be a teacher or a parent or a carer.
yeah,
This might be the only space where that information's not shared. So I
yeah,
think there's something, again, really privileged in me being able to offer that to them, and them
yeah.
having a space to sit and feel like, right, okay, this is my time to kind of take the reins almost of my own life, rather than it be someone telling them what to do.
Absolutely. And you see that transformation in the sessions almost, over time, once they get to the point of, actually, this isn't going anywhere and this is a safe place.
Mhm.
You start to see the change, and how they approach you and how they present to you and how honest they are. And so sometimes, everything's about relationships in life, and sometimes it might not be till the fourth or fifth session that that young person has finally trusted you to the point that actually you're not going to leave the room and speak to my parent. I remember I've had so many instances with parents trying to inject themselves into the sessions with stuff like, sending me an email before the child comes and go, just before we Johnny comes, just to let you know. And
Mhm.
and and I stopped reading there because I don't want to know. It's up to wee Johnny to tell me. I can't take anyone else's information because one, it's unfair to wee Johnny because it's not that person's information to give. But the other part
Mhm.
is that's only one side to a story. So
Yeah.
I'm there to listen to Johnny's side of the story and see and work through that. So, but you sometimes, I've had that so many times where I have to say to parents at the very beginning, look, don't email me, don't text me because I won't read them. I'm not in the kindest way possible, but I don't want you thinking I'm ignoring you, but I won't read you if you send me information about how they're doing that week, because that's my job to speak to them about whenever they come in. And they
Mhm.
need to have that space to do that with their own
Yeah.
free will and not feel like it's been done in advance. Do you know that kind of way?
Yeah, absolutely. And I think that is the nice part about therapy. Not so much for the parent, because or the carer. I know that can feel really really difficult to just be able to let that go, because we are so used to, if we take our child to the doctors, we hear about it. If we take our child to the dentist, we hear about it. Whatever it is, we normally get updated. So when we're used to that type of communication, and then now suddenly we're flung into a situation that is really vulnerable for not only the young person coming along, it's a vulnerable position for the parent as well. So I can totally understand why parents want to know, but equally it's about allowing that young person to have this space that's theirs, because that's the part that's really helpful. That's the part that allows them to be themselves, even if it's for that 1 hour a week. They've
Yeah,
got a space where they can let things go, knowing that it's not going to go anywhere.
totally. Aye. And you're right. I mean, we're touching on families there and parents and caregivers, and it is difficult for them because, I mean, I can imagine if me as a parent, if the shoe was on the other foot and I took, my child to a therapist and knowing all that I know, and still I would probably be thinking, well, why will they tell a stranger and not me? Do you know,
Mm-hmm.
why will they take that space? But sometimes they need it, and it's about us kind of getting over ourselves a wee bit as parents and thinking, actually, do you know what? It takes a village, and I won't always have the answers, and I need that support from other people and other professionals to, just like you would go to a dentist to get a tooth extracted, or you would go to a doctor to get a plaster of Paris on a broken leg. Do you know, I don't have
Mm-hmm.
the skills to do that, so I'll take it to the appropriate person. But as a parent, I will nurture them, I will care for them, I will love them unconditionally, and that is the role of the parent. But it is
Mm-hmm.
difficult, you know. So, I mean, thinking about that, because you work with families as well. So, what support do you feel that the families might need to support, like their children and young people who are going through therapy?
Yeah, I think it's understanding firstly that because your child has come along to therapy doesn't make you a bad parent. Doesn't mean to say that you've done anything wrong. It just potentially means that this young person needs a space in which I think even for adults, sometimes going into a space where someone doesn't know you, they know nothing of your story, and it's like a blank slate, and then you get to
Yeah.
write that story. I think that's the part. So it's not always about that the parent's done a bad job or that you've been a bad parent. Absolutely not. It's just a case of this young person may feel just that bit more comfortable talking to somebody that has no emotional connection to them in their life. Because I think for a lot of the young people I've worked with, it's not necessarily that they don't want to speak to a parent or a carer. It's potentially more that they're scared they're going to upset them. They don't want to then see that adult in their life in pain from what they're maybe going to tell them. So I think a lot of the time it's not so much out of fear of telling. I think it's the young person is trying to be so concerned with the other person's feelings that they then
Hmm.
don't want to like tell them something that potentially might upset them. So I think most times it comes from more of a place of that than it is that the parent's done anything wrong.
I think, I think you're right, because there's points where, I mean, certainly recently in the last couple of years, what, I've seen is children coming in, and the parents' anxieties and worries being transferred, not on purpose, but we've obviously gone through COVID, we've had a cost of living crisis, we've had an energy crisis, I mean, the world is in crisis constantly in these
Yeah.
people's young lives. So, but what they're hearing, at home, or while they're sitting upstairs and listening to downstairs, whatever's been chatted about and stuff, because we've all done it as kids,
Yeah.
is that you laugh because I think you were one of them people who sat up the stairs all the time listening to the floor.
But my dad's common comment was always, "You've got ears like an elephant."
Brilliant. But they pick up energy, they pick up
Yeah.
tone and mood, and I've seen a lot of young people in the last year or two certainly coming in, and it's worrying about their parents.
Yeah.
I'm really worried about my mum, because I think she might lose her job, because there's cuts and there's redundancies, and it means we might have to
Mhm.
move home. I heard my dad saying this, and it's not the parents' fault. It's not. It's absolutely not. It's not really anybody's fault, because it's the world
No.
we're currently living in at the moment. But whether we like that or not, that child will absorb that energy in the home. And if I'm not saying we have to pretend that life's amazing and easy, but I think some of the difficulties and what we don't do is we don't communicate to children and young people the way we do to our adults.
Hmm.
So that part at home where we, if there's something that's happening that's big, the part that will reduce the child's anxiety is, include them in the discussion. Not all
Yeah.
of it, about the worry about finances and stuff, but look, things might be changing soon, because, I'm going to be looking at another job, might have to get somewhere different, might have to get another job because, we need this, that, and the next thing. And I think when they feel included, they feel part of the solution and not part of the problem. And
Yeah.
it's my God, I don't want to ask for the school trip. I don't want to ask for the pound for
Hmm.
non-uniform day, because I don't know if we have it,
Yeah.
So I don't know how you feel about that, but communication and a level of transparency, I think, is really
Hmm.
important with children and young people. We don't give them the credit they deserve in relation to how they can hold this information.
Absolutely. And I think it's about being honest to a certain extent and factual as well about what's going on, because I think for a lot of young people, particularly kind of younger people, they internalize a lot, so they'll then start to kind of self-blame and take it on themselves, and that's just the way that their brains work at that age. So I think about being factual and being honest to the extent that's necessary. You know, like you're saying, there's certain details that maybe don't need to be shared, but enough that they can understand, here's what's happening, here's what, you know, what changes that might occur. What do you think? What's your thoughts and feelings? And including them in those decisions and conversations, and allowing them to, you know, they can understand far more than what we give them credit for. They know, they absolutely know. So I think it's about including them in that, and helping them feel, like you've said, part of the solution.
Yeah, yeah, absolutely. And the work that you've done with young people and families, have you seen a change in that environment and how things are supportive, or, what approaches are being taken now that was maybe different a few years ago?
Yeah, so one of my more kind of recent roles in family support was doing family group decision making, which is a type of model that's kind of pushed more now by the Scottish Government, and it's part of the promise. And it's really about helping families stay together,
Hmm.
but helping families come together to find solutions for their child. But the nicest part within that model is that the child is at the centre of it all, and their voice is at the
Yeah.
centre of it all. So part of the work that I did there was kind of sitting alongside families where there was potentially going to be social work intervention, and that, you know, there maybe it had been identified that the family had some struggles, and my role was then to sit with the children or child, understand what their thoughts were on the situation that was occurring, but then also allow that child to identify what members of their family, or could be a neighbour, could be a teacher, whoever else they wanted included in this
Mm.
process, they got to pick. And I thought that was a really nice way of working, because you're working with their voice at the centre of it
Yeah.
all, and you're pulling all of these adults together to help come together and find solutions for this child, but they were part of that discussion and part of that solution. And the really nice part of it was at the end of, because I used to go around and meet with every person individually that the child had picked. Sometimes you're meeting with like 15 adults, because they'd picked so many people that they wanted
Yeah.
involved. And the really nice thing was, at the end of it all, we would kind of pull all the voices together, and we would have a family meeting where the families would come down, and the child got to pick what food was there. It was most times like Domino's, McDonald's,
Yeah.
and they got to pick the food, and we got all the food in, and it was kind of like a wee party almost. That's what the
Um,
kids used to say, like, oh, when we have our party. But the adults would all come into a room, and we would talk about what's our worries, what's our concerns, what do we want to see change, what do we want the future to look like. And I would then leave the room, because obviously I'm not part of their family. So this is about really empowering children, young people and their families to have control over their own life, without that being a professional making those decisions for them. And that was really nice, because then they were coming up with solutions that they knew was going to work for them, rather than it be a professional going, go away and do this and go away and do that. They know themselves best. They know themselves as a family best. So it's better for them to find their solutions, because they know what will work and what won't, or what they feel they can try, and then if not, make that change. So I think out of all the family support work that I've done, that was absolutely my favourite, because it was just such a nice way of empowering those people, the children, young people, and the adults, to come together and make decisions themselves, without it being someone else telling them what to do.
that's amazing. And it sounds really like solution focused and
Absolutely.
inclusive and empowering.
Definitely. And you know, I think at times it was so heartwarming, because you would sit around the table, and the child would express their own views, and they've maybe never done that before. And I think at times a lot of parents and carers and adults in their life would go, oh, we didn't know you felt like that, we didn't know you thought that, or we didn't know you'd overheard that conversation and now you know about that. And it was such a nice way of the child being able to their worries without fear of upsetting other people, because we kind of said that at the beginning of the meeting, it's okay to share, this is what this space is for. And at times, you know, I could feel myself getting really emotional in the room with the families, because it's real life, you know. And whether it's family support or therapy, at the end of the day, the work that we do is real life. This is not a game. This is people's lives that we sit with every single day. So there's definitely a part of it that was very emotive for me, because you were seeing families share things with each other that they've maybe never shared before. And to see them come together and get to a place of understanding each other, and it repaired probably a lot of relationships as well, was just so heartwarming to see. And it's such a great model of working, and it's something that I really, really enjoyed doing.
It's amazing. Even the work and the model sounds fantastic, and I think that's something we continue to do. I hope stuff like that doesn't slip away, because the inclusivity, and we talked about that village part where it takes a village and everybody to come together to support each other. So hopefully
Absolutely.
that doesn't change.
No, absolutely. And I think it is becoming a lot more because that was I sat alongside social work in that job. So I think a lot of other counties are kind of taking that on board within social work where there is specific family group decision making coordinators that do that role specific because that was all, although I worked for a charity, I didn't work with statutory services, but we sat with them. That's where our referrals came from. But I think a lot of other counties are kind of taking that on board as a model of working.
Great, great. And one thing I wanted to ask you about as well, because I know obviously you talk about being a therapist, but you talked about at the beginning as well about doing face to face and online, and this can sometimes be that kind of debate of what's better, what's worse. I don't like using the word worse, but so what are the kind of the pros and cons you find to both, or what's your preference? Do you see a difference? Do clients find it okay doing online now in the digital world that we live in, and does it benefit that accommodation of time and accessibility?
Yeah, absolutely. I don't really feel that for me personally as a therapist there's a huge difference between face to face and online. I feel comfortable in both settings. I think it's more dependent on what the client's looking for because some people may not be able to access online in a private space. They may be living at home with other people and feel that they don't want to come on and have everybody else in the house hear what they're saying, which I absolutely agree with. You need your privacy within that. So they would probably prefer face to face. But I think for people who maybe are like working different hours or working quite late and don't have the time to then travel to face to face, accessing online is a lot quicker for them and allows them to access it. I've got quite a few online clients or have had a few online clients, and I've always had good feedback from online. I've not had anything to say that they haven't, got things out of their time online. And yeah, for a lot of people, it's the accessibility of it. You're just in your own comforts and you can, get online. And I think for a lot of people, it probably is the comfort of being in your own home. If you want to come on in your jammies, come on in your jammies. So, you come in your own comfort. So I think that's probably.
Right, and I think that's a good point to make. Everybody is different and has different preferences, just like, people have different preferences in the therapist that they go to see, or, where they see them. And online is becoming a lot more prevalent in accessibility and unfortunately, what seems to be a busier world that we're living in. And we have more home working where people have more home offices and privacy, and so they're kind of leaning into that a wee bit more and saying, so they can have therapy in their own space. And, it's interesting you talk about those comforts around them. So if they have those kind of comforters or blankets or, coming on their jammies or whatever it is, that as long as people can't overhear it, then there's nothing wrong with it. Yeah. Brilliant. Brilliant. Thank you. Well, thanks for that, Katie. I really appreciate the time and taking the time to share all your experience and expertise and all the different fields and work that you do. So we have a wee bit of a kind of closing tradition and reflection that I ask a lot of guests if they could think of maybe the one thing that stands out for them that maybe helped take back control in their lives. What was that and why? Yeah. Yeah. That's really interesting. It's an interesting spin to end on as well, because it can be about you want to be in control too much. So when they let go of that control as well, or the need for that control. So thank you very much. I appreciate you taking the time and for sharing it so honestly as well. Great. Well, thanks for joining me in session Taking Back Control, and we'll catch up soon. Thank you. Thank you for joining us on this episode of In Session Taking Back Control. If you enjoyed this episode, please subscribe, leave a review, and share it with anyone who might benefit from our discussions. For more resources and support, please visit us at Better You, and don't forget to tune in for another inspiring conversation. Until next time, take care and take back control.